Good morning. My name is Nichelle Curtis McQueen, and I'm happy to welcome you all to the 2022 National Association of Social Workers Legislative Action Policy Conference. I would like to start out by spotlighting our schools that are joining us today. We have a long list of schools from all over the country, including Arizona State University, Boise State University, Boston University, Capella University, Clark College, Eastern Washington University, New Mexico State University, Ohio State University, Pacific Lutheran, Portland State University, St. Martin's University, Seattle University, Simmons College, which I would like to say is my alma mater from my master's program, University of Kentucky, University of Nevada in Reno, University of New Hampshire, UW both Seattle and Tacoma, and Walla Walla University, as well as Western New Mexico University. Thank you all for joining us. I'm happy to say that this is probably the biggest group of social workers that we've had from across the country. Hopefully we can grow that more. So to give you a rundown of today's events, we're going to be hearing from Representative Simmons, Representative Johnson, Representative Rule. We're going to be doing a breakout activity with legislative assistants from the Capitol and some that were previously at the Capitol. And then we're going to be talking about the National Associations of Social Workers legislative agenda from this session. I would like to now introduce our Executive Director, Jeremy Arp, as he does a land acknowledgement and give you just some feedback on social advocacy. Jeremy?
Great, thank you, Nichelle. Again, my name is Jeremy Arp. I'm the Executive Director for NASW Washington State Chapter. I wanted to give a quick land acknowledgement as part of the work of the chapter and the Board of Directors. We have the goals to celebrate the original peoples of Washington through an acknowledgement. We wanted to name the role of colonization in taking land from indigenous peoples and identify the role of social work in upholding systems of colonization. We also want to name our intentions to build healing relationships and support tribes in achieving equity and justice in Washington. We also want to keep the history of our state in our conscience as an organization. So NASW Washington Chapter and its members occupy and work on the traditional lands of the Chehalis, Colville, Cowlitz, Duwamish, Ho, Kalispell, Lower Elwha, Clallam, Lumi, Makah, Muckleshoot, Nisqually, Nooksec, Puyallup, Kuyu, Quinault, Sklallam, Samish, Sauk, Seattle, Shoalwater Bay, Skokomish, Snoqualmie, Spokane, Squaxin Island, Still-Gawmish, Suquamish, Swinomish, Tulalip, Upper Skagit, Yakima Nation, and all the unnamed peoples incorporated by treaty into confederations whose relationship with this land continues. NASW Washington respects the relationship the indigenous peoples have as the original protectors and nurturers of this land we call Washington State. We offer up our gratitude for this land and for those who have taken care of it before us. We acknowledge that our organization and our members' history is interwoven with the colonization of Washington, and it is our intention to honor the indigenous peoples of Washington in seeking equity and justice for all Washingtonians. In the spirit of this gratitude and acknowledgement, we also declare responsibility and duty for social work in Washington to build collaborative and empowering relationships with the indigenous peoples in our state. So that said, I will post that in the chat as well. For reference, we will be introducing our events with land acknowledgement from here on out, and also on our website. So I wanted to wish you all a great day today, learning about social policy and about policy making in Washington State. And I know that for some, this might be a review, and for others, this might be your first time getting exposure to legislative processes in Washington State. I encourage you to, one, make sure you're registered to vote, and two, vote early, vote often, and also take a look at what your legislators are doing and make sure to feel comfortable reaching out to your legislators and lawmakers. So that said, I'm going to hand it back over to Nichelle. Again, welcome, and I wish you well today.
Thank you, Jeremy, for that. So we have up next our first keynote speaker. We have Representative Simmons from the 23rd District, which includes East Bremerton, Bainbridge Island, Poulsboro, and North Kitsap Peninsula. Originally from Bremerton, Tara is a graduate of Pacific Lutheran University and Seattle University School of Law. She's a fierce advocate for formerly incarcerated people, and she is a co-founder of the Civil Survival Project. She was elected in 2020 and serves on the Public Safety, Civil Rights, Judiciary, and Healthcare and Wellness Committee, where she advocates for fairer and more equitable legal, educational, and healthcare systems. She currently lives in Bremerton with her 2 sons. So with that, I welcome Ms. Representative Simmons to talk to us about advocating. Rep. Simmons, are you there?
Yes, I just joined. Hi, how are you today?
Thank you so much for joining us. I'm excited to hear what you have to say about your work at the Capitol this year.
Yeah, thank you so much. And thank you for having me. It's so wonderful to be with a bunch of social workers who are the backbone of our community and so necessary. We need more social workers. You know, I'm an attorney today, but I always say that if we had as many social workers as we do attorneys, our world would be a much better place. And that is really what I truly believe. I am grateful to share with you a little bit about myself and what I'm working on and how I'm supporting that vision that I hold dear. I represent the 23rd Legislative District and over here in Kitsap County. And I don't know if folks on this call know my background, but I am the first person in our nation who has been elected who spent time in prison. And so, as many of you know, how people end up in prison is through many other systemic failures in our society. I overcame intergenerational trauma. I have an ACEs score of 9. I grew up in poverty, was exposed to violence, was trafficked as a young girl, became a mom at 14. And, you know, everyone in my family had suffered with substance use disorder and been incarcerated. And so obviously I followed in that path as well. However, when I finally got access to, you know, mental health treatment and really learned how to deal with my trauma, I recognized the systemic barriers that are facing people once they have a criminal record. And so I decided to go to law school and work on uprooting our systems of oppression and bringing a more trauma-informed lens to our society and changing laws to make that happen. And so today I'm an attorney and I help people reintegrate into the community after incarceration, help them with record expungement and legal financial obligations and, you know, fighting for their civil rights. And then I am a part-time citizen legislature here in Olympia, in virtual Olympia. So I've been here, this is my second session. I just got elected and I have last year, you know, I led the effort to restore the right to vote for people as soon as they leave prison. I also led a bill in partnership with NAMI to create a statewide Office of Behavioral Health Consumer Advocacy to hopefully help get folks that are currently in mental health institutions and substance use disorder treatment centers an advocate, and also identify more systemic barriers that we need to continue to work to improve our behavioral health system. I have also last year worked on removing barriers for criminal records in becoming in-home care providers, because I know that people with criminal history can be really great at a lot of things, including caring for their elderly and aging parents and grandparents, and they should be paid for that work. So those were the bills I passed last session. This year, I am leading the, I saw on your support agenda, House Bill 1412, which is about court costs, fines, and fees, and that is going really well. But some of my favorite bills really are about getting school counselors and nurses in schools, right? The Alicia Rule Bill 1664, which you all are supporting as well. I'm very supportive of that. Also fighting for an increase in Medicaid reimbursement for behavioral health workers and increasing our behavioral health workforce. Like I said, when we have as many social workers in this world as we do lawyers, we are going to be so much healthier. People need connection, they need resources, they need support. And all of these, school to prison pipeline, I call it the trauma to prison pipeline, really, can be interrupted because of people like you. But we need to support you, and we need you to be able to have good work-life balance and have more social workers and supports for our community. So those are the things I am fighting for. I am grateful for all of you, and I hope that you get more involved in advocacy. Your voices are really important in Olympia. And right now, because of the pandemic, we've turned everything virtual, which is really great because now there is more opportunity for the public to engage. You no longer have to go down to Olympia to have your voices heard. And it's your lived experience and your stories that help educate lawmakers. Because we are a part-time citizen legislature, all of us come from different walks of life. And there's not a lot of people there who truly understand the adverse childhood experiences and trauma to prison pipeline. I'm very alone sometimes in this work. And I know that if you're a social worker, you're hearing these stories all the time. And if you can come and be an advocate for the folks that you're serving, or I know a lot of you are called to this work because of your own personal stories as well. And you find purpose in giving back. And so sharing your personal stories around a variety of topics is how you educate the lawmakers to make good policy that really works for the people of our state, and especially the marginalized people who probably you're coming in contact with a lot in your variety of your different areas of work. So I hope that you will get engaged in advocacy and have your voices heard. You can also email, comment on bills, and then when we get back in session, it's always fun to come down to Olympia and see the beautiful surroundings and the campus and the Capitol and talk with your elected legislators. They represent you wherever you live. You do have 2 representatives and a senator, and always share with them, and they should respond to you because you are their constituent. Share with them how you feel about particular bills and policies. So I am just really glad that you're having this day, and I want to encourage you to continue. And maybe someday one of you will run for office, or many of you will run for office as well. But we definitely need more people who really want to create a trauma-informed society. So thank you so much for having me. And I can answer a question or two if you like.
Absolutely. I was going to open up our chat to any questions any of you all have for Representative Simmons while we still have her for 5 more minutes. And thank you for your story. We as our chapter has followed your story. And for me personally, it's been so inspirational as I work with incarcerated youth. And so thank you for being here and sharing that story, and for all of the work that you do at the Capitol for social workers and the people that we serve as social workers. If anyone has any questions for Representative Simmons in the chat, you could please post your questions and we'll read them aloud. Not seeing any questions so far. I'll start off with a question.
Okay.
I can imagine we have a question. So I'll ask mine and then we'll get the next one. How did you break the barrier of fear of making the decision to run for public office with the barriers that you experienced from your story?
Yeah, I think, it's because I had to break so many barriers that it gave me the courage to break the barrier of running for office as well. I think, if you all know, I wasn't allowed to sit for the bar exam at first because of my criminal history, even though I graduated from law school and, did really well in law school and was completely transparent about my story while I was in law school. I had to fight that to the state Supreme Court. And when I did that, I got a unanimous same-day decision from the Supreme Court, which really validated me. It was the first time I ever really felt in my life that a system saw who I was in my heart and that my past didn't define me. And they said so in the decision when it came out, 6 months later. But I think that gave me the courage to say, you know what, I've already been very transparent. And if I don't run for office when the opportunity was presented to me from the former representative, and she was asking me to do it. If I don't do it, then whoever will. How will we ever normalize formerly incarcerated people in elected office? And so for me, it wasn't really about me. It was about the community I represent and wanting to break that barrier for them as well.
Thank you. Okay, our first question comes from Ann Allen. It says, there have been barriers to peer providers in mental health with legal history being able to work. I do work in the field. Any chance this will be addressed?
Yeah, so it is something that's on my interim project list, and I have been engaging with the workforce board on this issue as well, because I just did the bill around removing criminal history barriers for in-home care providers. I really want to see it happen for behavioral health workers because I think it is when we have lived experience that we can truly empathize with our clients and know like their struggle and sit and hold space with them. And so it is a top priority for me. It's just there's so many priorities. So I don't know. I mean, I hope that I have capacity to do it next year.
Yeah, thank you.
Mhm.
Our next question is, how can you set up a meeting? How can people set up a meeting with you?
Yeah, so Zach is on here. Zach is my teammate. He's my legislative assistant. He controls my life and my calendar. So you can email Zach Ellis. It's zach.ellis@ledge.wa.gov. At this point, it will have to be after session probably just because we are so busy. But I always love to talk with folks and hear your stories and share connections. So it'd be great.
You. And we'll do one more question. Any other questions, I will email to Zach and yourself with the people who asked them, and we'll be able to get those questions answered. So the last question is, speaking to the trauma to prison pipeline, how do you speak to putting services in place in schools to increase access to support for students and their families?
Yeah, I mean, that's why I love, House Bill 1664, which is an investment in school nurses and counselors. The more support we can give children, in their early ages and hopefully prevent adverse childhood experiences, I'm all for that. I think we need to go a step further and provide wraparound services to families, because a lot of times what we're seeing in our schools is the result of some kind of family issues. And if we could, catch them in school, but then provide that support to the entire family, whether that's overcoming poverty, domestic violence, food insecurity, housing insecurity, those issues are creating adverse childhood experiences for children. And so the more we can do to prevent that, the more we can interrupt the trauma to prison pipeline.
Thank you.
Yeah.
Well, thank you, Representative Simmons. It's been an honor to have you here today. Thank you for your work at the Capitol, and we're excited to see how your bills that you're supporting progress through the last few days of session.
Thank you.
All other questions that we have in the chat, I have got them documented, and we will get those questions to you so that you can answer them after session.
Thank you, and thank you for all of your work as well. It's very important. So thank you. Have a good day.
Bye. Okay, so the next thing that we're going to be doing is we're going to talk about the National Association of Social Workers legislative agenda for this year. This agenda was created by the Legislative Action Committee members and help with our lobbyist, Bob Cooper, who is our person who's running on the ground at the Capitol or in today's day virtually. Bob Cooper is a managing partner at Evergreen Public Affairs, which has provided lobbying and strategic consultation on social services, behavioral health, drug policy reform, K through 12 education, criminal defense, nuclear safety, open government, and hunger relief issues for a variety of clients since 2003. He's previously worked 2 legislative sessions on staff of Washington State Senate, was Howard Dean's press secretary when Dean won the Washington presidential caucus, press secretary for the most successful initiative of Washington State history, which is the I-297, and for the last 9 years has been managing public policy on behalf of a major hunger relief organization at both state and national levels. He's an award-winning journalist and has been our lobbyist for many years. Bob, would you like to talk about how session has been going so far?
Well, weirdly. Good morning, everybody. Today is day 43 of a 60-day session. There are 17 left. And so everything that is going to happen is mostly going to happen in the next 12 days. The way that things are structured is there are cutoffs along the way. So if bills don't progress to a certain point in the process by given dates, those bills kind of fall off the table. There are some exceptions, and those include budgets and bills necessary to implement the budgets. Governor proposed his budget in mid-December. Very good budget because, quite frankly, the state has a great deal more money than they anticipated at this time last year. So the governor's budget was a good budget. This morning at 8 o'clock, the Senate released their budget. And once we get through some of the other policy areas, I'll do a recap on the budget. But quite frankly, I'm still digesting the budget and trying to figure out what is in there between all of the documents they put out. The House budget will be released at noon today. And then at 3:30, the House Appropriations Committee meets for a hearing on their budget proposal. And the Senate Ways and Means Committee meets at 4 o'clock for a hearing on theirs. So I will turn this back right now so we can go through some of the policy areas, but I'll be back in a few minutes with a recap of some of the highlights of the budget. And I believe next up is Adrienne.
Yes.
Morning, Adrienne.
So,
Meet yourself.
So as we establish our legislative agenda, we always look at top priority as professional issues. These are the issues that directly impact social workers as a profession. I would like to introduce Adrienne, who is going to share the legislative briefs and bills that we've supported around professional issues. Adrienne calls herself a transplant from Alabama to Olympia. She is certified oncology social worker, and she is in the process of earning her doctorate in social work from the University of Alabama. Adrienne?
Thank you. So we have 5 bills that we were looking at that focus on professional issues. The first bill is House Bill 1664, which was sponsored by Representative Rule, who will be here later today joining us. So that's exciting. So HB 1664, concerning prototypical school formulas for physical, social, and emotional support in schools. So the basic gist for 1664 is that right now, school districts have a lot of discretion over their spending. And so monies that maybe were given to them to pay for things like social workers, school nurses, guidance counselors, et cetera, they have discretion over that, and they can actually use that money to pay for another teacher or equipment or whatever. So what HB 1664 does is it will increase the minimum allocations for social workers, school nurses, guidance counselors, a few others, over the next 3 years, beginning this coming up school year. And also it will require the school districts to prioritize the funding for only these categories. So that means they cannot take the money and then use that for something else. This bill has passed through the House and is now into the Senate. So luckily it made the cutoff. The next one, House Bill 1688, protecting consumers from changes for out-of-network health care services by aligning state law and the federal No Surprises Act and addressing coverage of treatment for emergency conditions. So a lot of you may have heard about the recent No Surprises Act that came down at the federal level. What that is trying to do is saying if you go to an emergency room and maybe the hospital is in your network and you end up having to have a surgery, but the surgeon is in your network, but maybe the anesthesiologist is not. Well, no one tells you that, and you get this ginormous bill at the end. What this No Surprises Act does, it says that the hospitals and medical facilities have to let you know if something is out of network. And what this particular bill, 1688, is doing is it is aligning state law with that federal law, because right now Washington has a version and there's the federal act, and there are some places where they just diverge. So it's just bringing them together to make them a lot easier to understand and getting rid of the conflicting regulatory practices. And that one has also passed the House and is now in the Senate. Next bill, HB 1736, establishing a state student loan program. So what this would do is create the Washington Student Loan Program. Student loans would be awarded beginning in the 2024-2025 academic year. To qualify for loans, student must be a resident of Washington, have a family income at or below the state median family income, and be enrolled on at least a half-time basis at a public institution of higher education, and of course do a financial aid application. And all undergraduate students who meet the requirements are eligible. If you're a graduate student, you would need to be enrolled in a specialized field of study that has a workforce shortage. This does frequently include social workers. So yeah, that's HB 1736. It has also passed the House. Senate Bill 5799, modifying the application of the Workforce Education Investment Surcharge to provider clinics and affiliated organizations. So this is a relatively complicated bill. It just involves a lot of financial jargon that frankly I had to do some Googling on to figure out what they were talking about. But listening to Senator Robinson, who brought the bill forward, what it's basically doing is the Washington Business and Occupation Tax, the B&O tax, has a workforce education investment surcharge that is applicable to any company that is considered an advanced computing business. It doesn't apply to hospitals or financial institutions. However, what prompted Senator Robinson to bring this forward is part of her district is the Everett Clinic. And Everett, a few years ago, was merged with United Healthcare's group Optum Care. And Optum Care is, of course, a global business, and they qualify as an advanced computing business. So the Everett Clinic, since the merger, is now being brought under this business and occupation tax. So what 5799 is doing is it is expanding the list of entities who are exempted from this surcharge to include not just hospitals, financial institutions, but any sort of provider clinic that has primary care, multi-specialty, or surgical services, including behavioral health. So this bill is still in the Senate, but because it is part of the budget, that's why it's still alive, even though it's not moved out of its House of Origin yet. So last one, Senate Bill 5884, establishing behavioral health support specialists. So in May of last year, the UW Department of Psychiatry, got funding to develop and implement a program that would train bachelor's degree level practitioners as behavioral health support specialists. It's based on a program that came out of England, the National Health Service. And so what the behavioral health support specialists would be, they would be defined as paraprofessionals who have at least a bachelor's degree level of education. They would then receive some additional training, and then they would be able to practice in partnership with a licensed behavioral health professional who has behavioral health in their scope of practice. So a licensed clinical social worker, nurse practitioner, et cetera. And so it would, of course, it would also have to require the Department of Health to develop rules for the certification of the support specialists. So the reason this is a good bill is it lets people with mild to moderate behavioral health conditions to access this low intensity evidence-based health intervention, especially right now when we're having a hard time finding patients behavioral health services. So this would just add another level of service for people who don't need someone quite as advanced. So that one also passed the Senate and is now in the House. So that is all of the professional issues.
Thank you, Adrienne. And for those who would like to view these documents, all documents and videos will be posted to the Voter Voice website. They are already on there, and that is the site that you registered to come to this conference. The next set of bills are behavioral health bills. This will be presented by Christina Mason. Christina is a licensed independent clinical social worker who has been a member of the Legislative Action Committee since 2020. She currently works as a program manager for King County Drug Diversion Court, a program offering comprehensive treatment, supportive resources, and an opportunity for felony dismissal for adult charged with property crimes and other drug-related felonies. She previously worked as an emergency department social worker, outreach worker, and case manager. Christina, thank you for sharing these next set of bills regarding behavioral health.
Thank you, Nichelle. So we know that behavioral health issues impact people in every community and workplace setting, and promoting mental wellness is truly a public good. So this legislative session, the chapter is supporting bills that address mental health concerns among a wide variety of community members, students, individuals involved in the criminal legal system, children, families, and adolescents, and also police. The specific bills that we're supporting: House Bill 1834. This bill requires schools to categorize mental health related absences as excused absences due to illness, health conditions, or medical appointment. So it allows students to attend to their mental health needs without negatively impacting their academic performance. And this bill also requires that a statewide student advisory group be consulted in the further development of absence guidelines. We are also supporting House Bill 1637 that is sponsored by Representative Simmons, who we heard from earlier this conference. This bill allows a court to mitigate a criminal sentence when the defendant was experiencing mental illness at the time of the crime. So courts are bound by sentencing guidelines that basically prescribe the range of jail or prison time that an individual can be sentenced to for any given crime. But if there are specific mitigating circumstances that apply, judges can impose sentences that are below the standard sentencing range. And because mental illness may interfere with an individual's capacity to understand the consequences of their actions or to control their behavior, this bill is explicitly adding mental illness to the list of mitigating circumstances that a judge may choose to consider at the time that they are sentencing someone. We are also supporting Senate Bill 5894. This bill establishes community health workers within pediatric primary care settings who will provide outreach, informal counseling, and social support for health-related needs. The community health workers would primarily serve low-income children who have Medicaid insurance. And the bill also requires that a curriculum be developed so that the health workers can be more effective in serving children, adolescents, and families. Also, it requires the development of a value-based payment system. And finally, we are supporting House Bill 1000. This bill recognizes that law enforcement officers who are not well do not serve the public well. So it authorizes the establishment of a behavioral health improvement and suicide prevention program for police and establishes several pilot projects so that law enforcement agencies can apply for funding for projects like wellness promotion campaigns, embedded mental health professionals, peer support, resiliency training, or critical incident stress management.
Thank you, Christina. And we have a question in the chat wondering about House Bill 1637 and how the exclusion for drug and alcohol use is impacted by a diagnosed substance use disorder as listed in the DSM-5. Would you be able to answer that, Christina, or would that be more appropriate for Bob?
What I can say is that my understanding is that the exclusion for voluntary, as they called it in the statute, voluntary drug and alcohol use, that was not something that was added in by Representative Simmons. That is in the existing statute. And so it simply isn't changed by this addition of specifically adding mental illness. It does seem like a bit of a conflict that substance use disorder is in the DSM, so could be considered in some ways to be a mental illness, but that is just something that this bill does not speak to. And I'll let Bob chime in at the end if he has anything more to say about that.
Go ahead, Bob.
Well, I would point out that the first thing you have to do is divorce the idea of logic from politics. And there's a lot of angst about mitigating sentences because of drug and alcohol use. So when you get bills like this in public safety, you're not going to get a logical porting over of what are classified as mental illness in DSM-5 into the public safety bills. And so that's basically the explanation.
Thank you. Thank you for that. Moving right along, we're going to talk about our social justice bills. This is going to be presented by Arden Himmelman. Arden serves as a lecturer and faculty member in the University of Washington Office of Field Education. Arden's career began in Seattle, working for and helping to start a community-based organization, partnering with communities, schools, and families to help children and youth thrive in schools. Her experience also includes management of family support center, grant administration, and program oversight for new funding streams for private and public organizations. Thank you, Arden, for presenting on our social justice stuff.
Thanks, Nichelle. It's great to see everybody here this morning. Thank you. And as Nichelle mentioned, I'll be speaking to actually 4 of the social justice bills. Nichelle's going to speak to the first one, which in her Reimagining Public Safety talk a little just after me. So there's 4 bills under the social justice section. They all happen to be introduced into the House, and all 4 of them are also now have made it into the Senate. The first one we'll be speaking to is House Bill 1048, who was introduced by Representative Wicks, an act relating to the removal of specific religious references regarding the criminal mistreatment of children and vulnerable adults from a statute. So this bill removes the language Christian Science practitioners from the criminal mistreatment and child abuse statutes. So what this does is it resolves a constitutional issue created by listing a single religion in the statutes. So healthcare decisions made in reliance on faith-based practices do not constitute negligent treatment or maltreatment unless any such decision poses a clear and present danger to the health, welfare, and safety of the child. The next bill is House Bill 1141, introduced by Representative Rood, and it increases the access to the Death with Dignity Act, which was previously passed. It expands the list of professionals who can perform the duties of an attending or consulting qualified medical provider. It reduces the waiting period between a patient's first and second oral request to 72 hours and may be decreased further. It also eliminates the 48-hour waiting period between the patient signing the written request and the prescription being written. And it prohibits employers of providers to prohibit an employee from providing Death with Dignity services when providing the services outside of the scope of the employment and off the employer's premises. The bill also requires hospitals to report their Death with Dignity policies to the Department of Health. House Bill 1860 was sponsored by Representative Davis, preventing homelessness among persons discharging from inpatient behavioral health settings. It calls upon the Performance Measures Coordinating Committee to convene a work group to establish performance measures that track rates of homelessness and housing instability among medical assistance clients. It requires managed care organizations to provide housing-related care coordination services. And the bill requires psychiatric hospitals to provide discharge planning at least 72 hours prior to a patient's discharge. The fourth bill, 1866, which was sponsored by Representative Chop, assisting persons receiving community support services through medical assistance programs to receive supportive housing. This bill establishes the Apple Health and Homes program to provide permanent supportive housing benefit and a community supportive service. The bill treats chronic homelessness as a medical condition and pairs treating healthcare problems with healthcare solutions. So as I mentioned earlier, all of these have been introduced into the corresponding chamber and are now in the Senate.
Thank you.
Yeah, thank you.
So the next set of bills we're going to talk about are surrounding our reimagining public safety bills. This was a priority for our chapter last year with all of the bills introduced around reimagining public safety. The first bill is 1735, which is modifying the standard for use of physical force by peace officers. This bill was introduced by Representative Johnson, who will be soon hearing from in a few minutes around his work around reimagining public safety and mental health. Essentially, this bill puts in more standards around de-escalation tactics and more, it eliminates some of the forces that could be used by peace officers, specifically the chokehold. Okay, sorry, let me get my screen set up. So the next set of bills we're going to run into are our economic justice bills. This will be presented by Claudia Selmeyer. Claudia was a trained worker as a social worker in Germany, mainly working in unhoused young adults, providing wraparound services. She is now a faculty at the University of Washington, Tacoma of Social Work and Criminal Justice.
Thank you, Nichelle. I'm going to wrap out the policy briefs talking about economic justice. And as you will see, they're connected to the other areas as well. So the first one would be House Bill 1947 and the companion bill, Senate Bill 5838, related to providing a monthly diaper subsidy for parents or other caregivers receiving temporary assistance for needy families. This bill passed the Senate and will be moving on to the House now. And it proposes that the Department of Social and Health Services provides families who are eligible for TANF or temporary assistance for needy families and who have a child under the age of 3, that they receive an additional monthly diaper subsidy. And the bill has 2 goals. On the one hand, to support children's health outcomes, because they found that because of the financial strain to afford diapers, families are less likely to change diapers, leading to certain conditions for the kids, but also increased parenting stress because, parents can't meet, their goal of being supportive parents. So, as I said, it passed the Senate at this point. House Bill 1412, sponsored by Representative Simmons, and she mentioned it already. It relates to legal financial obligations. So this is actually a change to already existing Washington code. And the bill would allow courts at any point in time to determine that an offender does not have to pay restitution or interest on restitution. So there's 2 conditions here: if the restitution is owed to an insurer, an insurance company, or to a state agency, and if the offender is considered to not have the financial means now or in the future to pay the restitution. So it opens a door for the court to, again, alleviate debt that can accumulate paid on unpaid restitution under these 2 conditions. This has also passed the House. Senate Bill 5793, sponsored by Senator Wilson, concerning stipends for low-income or underrepresented community members of state boards, commissions, councils, committees, and other or similar groups. So the Washington State Legislature acknowledges the importance of having community members participate in governmental boards and commissions to work on the implementation of bills, especially to bring their lived experience to these boards and make sound decisions. But they also recognize that that can be a strain for low-income community members. So this bill would allow the commission to pay stipends to community members who participate on these boards if they're low income or provide lived experience. These stipends can't exceed $200 for each day of official meeting and attendance. People might also be eligible for travel reimbursement or child and elder care. One caveat, this payment depends on the availability of funding. But again, the goal is to make sure that community members that might face financial barriers are still able to participate and provide their critical insight on the implementation of bills. Another one is House Bill 2050, repealing requirements for parent payment of the cost of their child support, treatment, and confinement. This bill would repeal the requirement of parents or other legally obligated persons to pay a portion of the cost of their child support, treatment, and confinement in Department of Children, Youth, and Families Juvenile Rehabilitation residential facilities. And it would also repeal the ability of courts to order that parents or custodial parents have to pay or contribute to the payment of the cost of their child's detention. And it cancels debts tied to these charges. So if it happened in the past and you're having accumulated debt now because you were not able to pay these charges, and would stop all legal action against parents previously ordered to pay these costs. So it's also retroactive. Lastly, it's Senate Bill 5592, also sponsored by Senator Wilson, and it refers to eliminating the cost of supervision assessments charged to offenders. This would also be an amendment to existing Washington law, and it would allow the Department of Probation. So right now they are allowed to charge a fee to process applications for felony and non-felony offenders requesting their transfer of supervision from out of state. And this amendment or change would eliminate the fee for processing supervision transfer applications. Thank you. It also passed out of the Senate. So all the bills up here passed either out of the House or the Senate. So they're moving on to the next chamber.
Thank you, Claudia. And then last but not least, we'll bring back Bob Cooper to talk about the budget.
And as I said earlier, the Senate budget was released at 8 o'clock this morning. So I'm still in the process of plowing through what is literally, multi-hundreds of pages. Follow up on a couple of things that were covered in the policy briefs. 1688, aligning the Balanced Billing Act with the No Surprises Act. One of the key things for behavioral health work is that it expands the definition of emergency services to include post-stabilization services and emergency services provided by behavioral health providers. There was a question in the chat about someone was interested in how do you affect change as you become a social worker? What fields should you consider? Two that I would say are emerging and seem to be growing are working in the public safety realm, because there is a continuing movement to replace people with badges and guns with behavioral health specialists in appropriate situations. And there's also a big focus on kids. So school social work is also a field that you might want to look at. And my mouse seems to have died. Oh, that's wonderful. Okay. The payment for people with lived experience to participate in boards and commissions, that is also funded in various scattered spots throughout the budget with small amounts at individual agencies. So if you read the documents that have been posted online, it doesn't show up as one big chunk of money. It is scattered amongst a number of agencies. One of the biggest things for social workers is that the budget follows the governor's recommendation in raising the allocation for school social workers that were highlighted in bills in both the House and the Senate. The House bill is the one that's currently alive, but the numbers have become the same. Basically looking at the allocations, and thank goodness they actually have built a fence around these allocations. So now they can't be spent outside of basically positions that help kids. It's nurses, counselors, social workers, occupational therapists, psychologists. The allocation for social workers goes from the current, for instance, middle school allocation of one social worker for every 72,000 students to one social worker for every 4,900. No, that is also an absurd number, but it's progress, significant progress in the right direction. And it actually is $172 million in the current biennium and $614 million in the next biennium. There's $100 million for behavioral health workforce stabilization, some one-time grants to clinics so they can keep open, and an attempt to actually raise pay for behavioral health services with an $18 million allocation current biennium and a $72 million allocation for the next biennium to increase rates for Medicaid behavioral health services through managed care organizations. I suspect, but have not done the calculation yet, that is the 7% increase that was requested rather than the 4% increase that the governor had proposed. There's $27 million for operating costs for youth and adult crisis stabilization facilities. There's $5 million this biennium, $18 million next biennium for opioid treatment provider rates. There's $12 million this biennium, $24 million next biennium for student retention and financial aid. There's $5 million for regional institutions to provide student support. Mostly it's at Eastern Washington University for a trauma-informed peer mentoring program. And then in social services, they've done a number of great things. They've added $38 million this biennium, $91 million next biennium to increase the Aged Blind Disabled grant to bring that up to parity with the TANF grant. In TANF, they've added another $1 million to slightly increase the grant for large families. And the diaper subsidy that you heard about, there's $100 million there to actually up the diaper subsidy for households with kids under 3 by $100 a month. There's $11 million or $9 million for expanding basic food, which is colloquially referred to as food stamps. There's $50 million this biennium, $75 million next biennium for Working Connections childcare. There's $3 million for a workload study to try to figure out how do we have DSH or DCYF caseworkers not putting kids up in hotels or offices or in cars overnight. And then $125 million in support grants for communities affected by disparities in historical criminal laws and penalties for illegal drug sales, possession, and use. So that's some of the highlights that I've been able to glean out of the hundreds of pages of budget documents at this point. There's a hearing on the Senate budget at 4 o'clock this afternoon. As I said, the House budget comes out at noon. It has a hearing at 3:30 this afternoon. And then once both sides pass a budget for the next 16 days, they'll arm wrestle over line items, line by line, going through who spends what on what, and come to some kind of an agreement. And normally we'll see the budget pass sometime in the last 5 days of the session. So something short of 2 weeks from now. And that's what I have at this point.
Thank you, Bob. You always find a way to put budget into layman's terms for all of us to understand. So we are currently a little bit behind schedule and are scheduled to hear from Representative Jesse Johnson from the 30th District. To respect his time as he has fit us into his schedule, we're going to postpone our break until after we hear him speak. So I would like to at this time introduce Jesse Johnson, Representative Jesse Johnson. Representative Jesse Johnson is a lifelong Federal Way resident and is a graduate of the University of Washington with a bachelor's in arts and political science and a master's in education. The son of a Navy veteran and a commercial residential painter, Johnson is the youngest city council member in Federal Way history, where he first took office at the age of 27. He now serves as one of the legislators' youngest members, where he works to helping families, working families, seniors struggling with high costs, students looking for the right pathway to a good paying job, and families struggling with housing insecurities across the state. I would like to add that Representative Johnson has also won the NASAW Washington Chapter Public Citizen of the Year Award for his work around reimagining public safety, access to mental health, and other legislative bills that he has help advocate, that help social workers and the clients that we serve. So at this time, I'd like to turn it over to Representative Johnson. Hopefully he's in our room, for him to talk to us about what he's been doing at the Capitol. Looks like he's logging in. While we wait for Representative Johnson, I'd like to open up the floor for questions that are currently in the chat. Garrett, it looks like you've been answering several questions. Would you like to read any of them aloud and follow up with answers?
Well, I'm happy to take a question that people haven't felt like was addressed in the chat. Absolutely. And just so everybody knows, my name's Garrett. I'm currently the president of the board of NASW in Washington. And I'm grateful to have everyone here with us today, and want to say a quick thank you to the LAC for putting this on. I'm pretty sure I caught up on everything unless I missed something. So if someone wants to raise their hand, feel free. I'm happy to answer something while Jesse gets logged on.
We got a hand from Laura, and then Representative Johnson is just logged in. So Laura, I hope I said your name correctly. Go ahead and ask your question.
Yeah, you said it correctly and just cut me off as soon as he comes in. So I did have a question about tightening up the language around House Bill 1412. There was currently something in there about ability to pay in the future, and that is so wide open. And I'm wondering how that might increase inequity in application, and how one would come in and amend that to be maybe a little bit more explicit.
So are you asking about the language in the bill itself?
Yeah, so currently it says the ability to pay now and ability to pay in the future, and that is so nebulous. And how would they determine ability to pay in the future and logically apply that? There's just no way to really predict that or know that. And I can see how that can lead to disparate populations having that applied unequally depending on where they are or who they are or whatever.
Absolutely.
I can give a short answer to that one.
Thank you, Bob.
There is current law elsewhere in statute about ability to pay, and there's a list of social service programs, including TANF for immigration assistance and some other things that, and Medicaid, that if you are on those programs, you're automatically deemed not having the ability to pay. If you are on something like ABD or SSI, you would automatically be assumed to not have the ability to pay in the future. Otherwise, it's kind of a judicial discretion thing. And yes, it can lead to abuse. It's the kind of thing you have to monitor going forward. But it's, quite frankly, it's a better situation than we have now. And since I see Representative Johnson is here, I will clear the way and
Thank you.
make room for Jesse.
Welcome, Representative Johnson. I just did your introduction, but I would like to formally congratulate you on winning the Public Service Award for NASW. I will let you take the floor and talk about some of the work that you've been doing around reimagining public safety and your expansion of mental health services.
Thank you so much, Nichelle. It's always great to see you. It's always great to be in this space with just so many people that are doing amazing work on the front lines, and the visionary leadership that social workers have right now with the pandemic, and obviously economic uncertainty, educational uncertainty, social unrest, and a lot of just challenges in our communities. And the work that you all do is just amazing. And of course, I'm a little bit privy to that work just from, I had a grandmother that was in the social working space who helped raise me and just taught me to really be a good human being, to be honest, and just embrace community. And so I really appreciate that work. I'll begin by just saying again, I think right now we're kind of in one of those moments of awakening as a country as it relates to systems working or not working, and how we try to align the work of the people on the ground with policy, and also keep equity, social justice, and truth at the center of the work that we do. And for me, that kind of means keeping my balance on tough issues like police reform, behavioral health reform, and my honesty about the world around us. And the reality is, when you look and see, folks getting, corporations getting richer and richer, folks getting richer but less, more people becoming homeless, or more people suffering from behavioral health and substance use disorder, it shows just a real inefficiency and inequitable part of our system. And I think that we have a lot of work to do in that space as legislators to address it. And so last year, of course, my work was really in the police reform space. And, I did not come to the legislature to work on police reform and public safety. I actually am an educator. I taught for a few years and served as a high school, college, and career counselor. So education, career pathways is really my expertise. But community came to the legislature and said, we want Black legislators leading this work on police reform. And of course, that was pre-2020 election, so we only had 3 in the legislature before everyone got elected. So myself and Rep. Intamin and Rep. Lovick, we decided, and Rep. Morgan, I guess there was 4, but she was not going to take on police reform. That's not what she wanted to do. So I think the 3 of us decided we were going to take on this work and kind of split it up. I took on House Bill 1140, which said that officers had to give young people access to an attorney when they're being questioned or interrogated. That includes at schools with school resource officers. And we've seen an over 50% drop in young people in the juvenile legal system in the last 6 months since that bill went into effect. House Bill 1310 around use of force, which said that we had to have a uniform statewide standard around use of force, prioritizing de-escalation. So pre-2021 session, different jurisdictions had different standards. You would get treated differently depending on what city you're in. And we wanted to have a uniform standard around de-escalation, of course, taking into consideration the totality of the circumstances, and mental health being one, if someone's pregnant, if there's a presence of children, and all those things. And I think, this work came from community, was led by community in the 940 process in 2018, where voters, passed I-940 with over 65% of the vote. And we said, as a public, we wanted de-escalation, and 1310 really set in stone that de-escalation policy. And finally, House Bill 1054 around police tactics, which banned the use of tactics that were rooted in racism and the war on drugs, like no-knock warrants, chokeholds, lateral vascular neck restraints. It also restricted the use of tear gas, military equipment in policing, and also the use of canines. So this work was really, again, rooted in community, and the goals still remain the same: de-escalation, limiting unnecessary police violence, accountability. But we still have to, any systemic reform, you're gonna have to tweak the bills, you're gonna have to make it a little bit more effective. And what I've learned in the last 6 months is we've done a really good job at limiting deadly force. We had 64 people killed by police in 2020, pre-last legislation, and 19 in 2021. So over 60% drop in people killed at the hands of police. However, we've also seen an increase in socioeconomic related crime. And a lot of that obviously is not due to the bills, but due to the pandemic, due to the lack of mental health and substance use resources in communities, specifically communities of color. But I think we also have to address what's happening on the ground. And so this year, we're bringing forth a couple of bills that will, I think, adequately respond to what we've seen in the last 6 months. House Bill 1735, which is my bill, which clarifies that law enforcement can be involved in mental health situations where someone's creating like a public disturbance, and they're obviously going through something mental health or substance use related. And the officer can come in and secure the scene and use reasonable force, subject to the reasonable care standard, to get that person into police custody and allow the mental health professional to do their assessment. Same with EMTs, with firefighters, getting someone on a gurney or stretcher, and using reasonable force, of course, not excessive force. And then House Bill 2037 from Representative Goodman, that I'm also a part of building out, which says that officers can use reasonable force again to stop someone from fleeing a Terry stop or investigative detention. So we've seen a lot of times where, you know, some people that are being questioned by police, they just take off running or walk away. And under 1310, effectively officers cannot stop them. And there are those people that, you know, run away even if they did not commit a crime. We see that a lot of times in the Black and brown community just because of lack of trust with police. But there's also those people that are trying to get away from the crime that they committed, right? So this bill is saying that officers can use reasonable force like compliant handcuffing, pat downs to get someone into police custody and continue their investigation. It can only be up for, you know, 10 to 20 minutes. You can't go and have someone slammed against a police car all day, or put a bag over their head like what happened to Manny Ellis and excessive force like that. It has to be under the reasonable care standard we established in 1310. And so this work is really being responsive to what we've heard in community that people want, which is holding not only police accountable, but also people that commit crimes accountable as well. So that's that work. And then finally, just investing in our behavioral health system. Of course, you know, we've seen decades of incarceration that has not worked, where people are having behavioral health issues, substance use disorders. And the reality is drugs still are cheap and available. People are dying from overdoses. There's not enough families that can get their loved ones treatment because of the cost. And meanwhile, taxpayers are paying for the costs of incarceration, of trials and prisons that actually don't help people recover. They get out and they do the same crimes. It's a really vicious cycle and ineffective cycle. So instead of crowding jails, what we're working to build up is a behavioral health system that's focused on treatment, more case managers, more connecting to stable housing, more connecting to legal supports, and all of this wraparound services that can really help the individual to hopefully get back on their feet. And, you know, sometimes, you know, prison is the right thing for someone, but sometimes it's absolutely not. And so we really want to have a differentiation between our coordinated care services, whether it's in the prison system or the mental health system or the substance use system, but really all of the above. And so that's what this work, hopefully when the budget comes out today at noon, we're having a hearing and appropriations today about the budget, but hopefully it passes because it has a lot of investments in that space for positive long-term outcomes. So I'll kind of end with that, and I'm happy to answer questions about any questions you all have.
Yeah, there's several questions in the chat. So the first question asks that we want to hear more about any instances you are aware of social workers have been a part of the problem in upholding systems of oppression so that we can work to address those within our own profession.
Yeah, I mean, you know, trying to think about that from my standpoint, I've been in the system of education, right? And it's really subtle things. So I'll just give you an example in education that I've seen countless times. So, you know, I served as a 9th grade language arts teacher. Sometimes, you know, they would have me rotate and be the dean or be the behavioral health person after school. So people of color often are used as the people that have to deal with the challenges and the problems. And so the system is not really meant for itself to be held accountable to that. And it's usually kind of just given to someone else to just deal with it. And we see the same thing in policing. We see the same thing in social work, in public health. And so I think it's really looking at your system and seeing, you know, are you investing properly so people don't get burnt out and leave the profession overall, but are you investing in the right people and the right resources? And are you giving them adequate you know, support to do that work? And so right now with policing, you know, what we've seen is a real strong investment in equipment, tons of military equipment. You look in Federal Way where I live, they spend over $1 million a year on police uniforms and vehicles. But what about the adequate training? What about the mental health, the wellness, the self-care of the officer that's going into community? Are they, you know, healthy themselves to do that work? 75% of officers are former military vets. Are they getting the mental health and the support that they need to do that work? Because otherwise you're going to end up in a situation where they're traumatized, they're coming into work traumatized, and then you have a traumatized individual in the community and they go head to head, and it's never going to be a good outcome. So that's why investing in our systems in the right way is really important, and not just investing in problems, but investing in solutions. So I hopefully that answers your question a little bit, but that's what I'm focused on, is how are we investing in the actual system itself and the people in the system.
Yes. And then the last two questions, one's a little bit easier, and then one's more of a general question of a theme I'm seeing in our chat, is how do you define peace officers, just for our guests attending this conference?
So for me, a peace officer is a guardian of the community. And what I mean by that is when they see something that is going to impact both either the individual, the public, or you know, themselves as well, they are trying to solve the situation in a way that everyone benefits. So you're not gonna, you know, if you see somebody running down the street and they look suspicious, you're not gonna go and tackle that person and beat them up just because they look suspicious. You're not going to try to pull someone over because they look suspicious. You're trying to solve a problem, and you're trying to do it in a way where everyone can benefit, both the public themselves and that person themselves, you know, making sure that they are going to get home that night. And if they did do something wrong, you hold them accountable, but you're not trying to use your power with this warrior cop mentality and use that over someone else. So I think a guardian of the community really lives to that standard. I'm actually really excited about the work that's happening with our police academy. I visited in the fall a few times and actually sat with officers that were coming in as new officers or transfers from out of state, and they're getting, you know, the history of race in policing, where we talk about policing started as a slave patrol, right? And so they're getting that history that's so important to understand why certain communities don't have that trust, and why it's up to them, the person that's getting paid six figures, to learn that history and to approach the community in a way that is not detrimental to that history and to that person's trust. And so we're seeing that, and I think that's really important work. And it's just as important as practicing your firearm target practice, which they do enough of, because I saw it. And so I think it's just as important as that.
Thank you. And then last question, and this is kind of one that is trending in our chat right now, is around the 988 hotline and the role of social workers being paired up with police officers or peace officers to help people in crisis. And so if you could just talk to that a little bit more. I have a bunch of questions in the chat, but I know there's been a lot of conversations on what does that look like? What does it really look like? And what is really the social worker's role, as it's obvious that we will be playing a role with this system?
You know, the 988 system, a lot of it is that co-responder, officer, mental health professional, designated crisis responder going in. But a lot of the investment, when you look at it, is the dispatch, because one of the biggest issues we see is an officer showing up to a crime they don't even know what they're walking into. Same with the mental health person. And so the dispatch has to be able to deliver the right, proper information effectively and efficiently in a very quick way. And so it's a ton of investment into more dispatchers, the training for those dispatchers to give all the adequate information for that person walking in. And then of course, for the officer to know the training around de-escalation behavioral health. That work is happening. We're on a timeline for that work. So it was actually started in 2018 after voters approved I-940, the de-escalation initiative, and the academy has been training to that standard for the last 4 years. But to get everyone in the state trained to that standard is going to take until 2024. So we still have a couple more years to get all our officers trained on that. But the other piece is, how do they work with the mental health professional? And that work is constantly evolving, because mental health work is constantly evolving. So we're having to readdress what that training looks like almost every year. And so I think if we could finally get to a place where there's, you know, a little bit more stability in what the mental health designated crisis responder role is, along with their partnership with the officer, we're going to be able to invest in it a little better. But it is evolving a lot, and I've learned that just from talking with DCRs, countless, you know, numbers of DCRs in the last year about their work, and half the time they don't even know what they're trying to do. So we're trying to really work about, you know, what are the requirements that a DCR is expected to do in their assessment and their work, and how should the officer go in and secure the scene and be able to be a part of that partnership in a way that is effective.
Thank you. I know that that work is so ever evolving because, as you mentioned, it's so dynamic, and it's important that we try to get it as right as we can before it's truly rolled out in order for it to be successful. We still have a ton of questions in the chat. Representative Johnson, would you be okay if I emailed you these questions and you can answer them after session?
Yeah, of course. I'm always available, and I'll get back to you as soon as I can.
Yes.
And I have this till 11. Well, I guess it's 11:20, but I'm available till 11:30 if you want to answer a few more.
Yeah.
Otherwise, I'm happy to jump off too.
Yeah, no, definitely. Let's see if we can get some more questions. We have a breakout group, but this part has been very, very involved, and there's lots of questions that are being asked in our chat. So I'm just scrolling up. So someone asked, can you speak to the challenges with the way police are interpreting House Bill 1310 in relation to the responding to mental health crisis calls?
Yeah, so yeah, obviously House Bill 1310 did a lot. And whenever you have a lot in one bill, there's bound to be some challenges. And one of the things that it did, of course, was set a reasonable care standard and raise the threshold of when police can use physical force from reasonable suspicion to probable cause unless there's an imminent threat of serious bodily injury or harm. The problem with that is in the Involuntary Treatment Act that was set years ago, they have a different threshold, a much higher threshold for when police can be involved. And so they weren't aligned. And so a lot of I would say about half the departments in the state continued work as usual. They were just like, you know what, we're going to keep, assisting with that, and we're going to be subject to the reasonable care standard under 1310, even though it's a little bit misaligned from what's associated with the Involuntary Treatment Act. And we're just talking about behavioral health, severe behavioral health response when it requires a commitment. But also when there's just mental health things happen, when someone's having a mental health episode and creating a public disturbance, officers were also using that as we're not going to respond to that. And that was a problem because it doesn't rise to the level of a commitment, but it's still a mental health challenge in the community. And we literally didn't, nothing, officers can still be involved in that. Nothing changed. The Involuntary Treatment Act does not have anything to do with that. But a lot of their legal advisors, because of other things, decertification, other things that were kind of going around that the officers were a little bit worried about, they decided that they just weren't going to respond. Finally, it took the Attorney General's office 6 months to issue a public opinion, which was unfortunate that it took that long, but it did, in December, saying that law enforcement was wrong. They should have been responding this entire time to mental health cases that didn't rise to an ITA. And so, I think that was a big challenge. By that time, we had already started on House Bill 1735, and I'm still glad we're doing it because it's explicitly saying, officers, you can be involved in mental health cases. You can be involved in this way. Just be subject to the reasonable care standard. So I'm glad we're explicitly saying it. We have an emergency clause on it, so it'll go into effect as soon as the governor signs it. But the AG's office specifically said in their opinion, officers can respond to mental health calls subject to the reasonable care standard. And so I think, it's just one of those challenges in the system where you have misalignment, miscommunication, and you have different systems not talking to one another. And I'm hopeful that we're addressing this in 1735, so it's explicit, but it still shows the challenge in the system with that.
Thank you. Thank you for that. And thank you for your time. We have another activity planned with legislative assistances, but I would love to invite you back to our arena to talk more about your advocacy for social workers and the clients that we serve, Mr. Johnson.
Absolutely.
And congratulations on your award.
Thank you so much. I really appreciate it.
Absolutely. Okay. So for the sake of time, we have a breakout activity plan with legislative assistances and people that have worked at the Capitol alongside representatives and senators. We are behind schedule, so we would like to just hop into those breakout rooms where we'll be having an interactive question and answer portion of talking to macro social workers and how they came to be macro social workers. So at this time, Diana, who's been doing our IT, is going to put us into breakout rooms where we'll be able to do this activity. Welcome back, everybody. Hopefully that was meaningful and some educational things that you're able to gain. You were able to gain by talking to people who are doing this work. Our next speaker we have already here with us. We have Representative Alicia Rule. She spoke with us last year as she was in her freshman year as a legislator, and now that she's in her sophomore year, we want to hear about things that she's learned. If you have questions, please feel free to put them in the chat. She's going to talk about the experiences and things that she's learned from last year to this year. Representative Rule, are you there?
I am. Hello, welcome everybody. It is so lovely to see you here today. Speaking with social workers is always a delight, but it's especially welcome as she mentioned, I've been working really hard on issues that impact our clientele and our society over the past year, and it feels so good to be in good company with friends who are also doing the same work. I look out and see, your faces on this Zoom screen and just feel encouraged and full of hope in a time that's often very bleak. Our children and our folks in our communities are hurting right now, and this pandemic has been really brutal on people. So it is truly the work of social workers that is going to bring the healing that we need to our communities and to the individuals that we see in our communities. So I certainly am going to here for questions. I want to make sure we get to them. But I was thinking about all that I have learned and what can happen in a year. It's so much. It's a little bit hard and overwhelming to think about how to drill that down. One of the things I'm thinking about is advocacy and what makes good advocacy. And I know that maybe you've been talking about that in this forum already, but I have learned a lot. And what I would have thought a year ago, or even prior to that, in my role as a social worker advocating for clients for decades, is effective and good advocacy, partly was true and maybe partly not. I don't think advocacy is that different than the very clinical tools we give our clients one-on-one. And I wish the world had those tools. So I'm so glad you are all working in this field so you can teach them and spread them around. But, to me, a good advocate, I meet with many advocates and folks in our community on a 15-minute basis, mostly through most days. And the most effective folks that come in are the ones who tell me what they're feeling, what they're experiencing, maybe tell me their story and their need, and then make a request. That's good advocacy. It's not louder than that. It's not necessarily, there's lots of others who try different tactics. What really doesn't work is sending all caps emails. You would never do that. None of you would do that, or name calling. All the things that don't work in good communication don't work in advocacy. Calling people out and coming from this place of aggressive anger, it just isn't effective, I think, for any of us. I am refreshed and delighted to know that most of the people in the legislature actually want to help solve problems. We want to help people. That's why we're here. And when you can be articulate about the problem you're trying to solve and you bring our ideas, it's truly the best policy. It's the best policy that we can deliver when we have a lot of involvement from folks like you and folks like just really everybody that comes to us and gives their input, particularly from, it's been kind of nice to have committees on remote in that way, because people can just call in from their living room and say, hey, this is how this policy would impact me. And I just really appreciate that input. For me, that's what works really well. But I want to kind of get into the chat. Looks like there's a couple of things here I haven't had a chance to look at yet.
I had a question for you. You talked about how social workers can advocate to their elected official about something that's important to them. What skills would you think, or ways that you could think of doing that? Because I know sometimes we hear, straight to the point, because your guys' time, sometimes we're cornering you all and trying to get that message across. What are some things that we could do to educate you and encourage you to vote one way or the other by giving you all the information that we know?
Yes, I think that's a great question, and you said it well. That is really what it is delivering information so that we can make a decision based on all the input that we're getting. For me, I think one of the things I've learned is it's hard to fit everybody in. So we're usually doing these really short meetings. So short and to the point is helpful, but also something that I didn't know before I started doing this job is it's so helpful if you know who you're talking to. So before you come in, make sure that you have just Google us so you know what we work on. I sat in a meeting today where somebody advocated for 15 minutes on the bill that I prime sponsored. And I thought, well, like, gosh, we're already on the same page because I prime sponsored this bill. I've been, working it through the whole process. And we could have that time spent on what we can do to make it go. That's what I want to do. Like, hey, we're both on the same page. Let's establish that early and know that we have good work to do together because we're really partners. Advocates and legislators just can't work outside of each other. We need you as much as you need us. We work together to be able to get good policy moving forward. So I think that is one thing I'm thinking about. The other thing is knowing how to, and you don't have to know this, we are certainly able and I love helping people work through the process, but it's really important to know how bills move. And I always have up my website where I can put in the bill number so I know where it is. And if something's already dead or it's in a certain committee, it's pretty important to know where it is so that we can know where to send your emails and help you advocate for your issue. So I often do that, and I'm happy to do that, is to look it up for you and say, hey, it looks like that's in committee. This is the committee chair's name. You should send a bunch of emails there. But knowing that ahead of time can be really helpful because then we might be able to get into a little bit more depth, even with the parameters of that short meeting time.
Absolutely. It's very funny you mentioned that. So people attending today, we do have a video on our Voter Voice website on how to navigate the Washington State website. Christina Mason, one of our Legislative Action Committee members, recorded the video last year and has been found to be very helpful in navigating that website because it can be very overwhelming if you're not sure how to do it. We also have a video by our current board president, Garrett Ebel, on how an idea becomes a bill. That is also on the Voter Voice website. We were going to show it today, but due to time, we're going to skip over that part. And so it looks like we got some questions. Oh, questions are flying in now. So someone
I love these questions. They're so good. Thank you.
Can you see the chat?
I can see it right here. Do you want me to jump in?
Sure, yes, let's do it.
Questions. I love them. Thank you for asking. I might miss it because I'm just doing a quick scan while we're talking, but one of the questions says, how do you and other legislators stay grounded and don't become out of touch with the people they represent? That is such a great question because for me, it takes active efforts in connecting back in with my community. And so that's what I do. I have certain people, they don't know who they are, who are friends and constituents and folks that I know in my community that I'll just call and chat with because I just want to hear how their day's going, how their week's going, what's happening. And when I hear from them in a less formal way, I just find it to be really helpful because it doesn't take long if you're doing, really some deep listening to folks, it doesn't take long for the issues to come right up to the surface. It's like we are a citizen legislature, so I'm living this with you, whatever the issue is, I'm probably dealing with it too. I met with my staff over the weekend and I heard, all the things that make this job hard right now. And when I say that, I guess I mean in my day job, but that's clinical social workers. And I was just listening to what's your life like right now? What kind of things would you need and what's making your job hard? And I heard a variety of things that are all pieces of what we're working on in the legislature. So living a citizen life, I think, is one of the ways we stay grounded, and staying in good communication with people outside of Olympia is really important. Let's see, what gets your attention when someone comes to you? Well, for me, if you're coming to me as a social worker, that does it right there. That's going to get my attention right off. But I try to give attention to everybody. I do want to hear from everybody. I think it's really important part of my job to be a good listener, maybe number one. But so, I really just don't say no to people when they're coming through my door. I'm a yes, come in. Yes, I want to hear from you. I think good policy comes from hearing a variety of perspectives. So I am not the kind of legislator who says, you've come to my door and I have an idea about you or what you believe, so you don't get to come in. I more welcome those conversations. Sometimes they're really hard, but I feel like that's my job and my role. So I think everybody probably is going to get some of my attention. I think that as long as you don't speak in bold, name calling, swearing, all caps, I'm going to read your email, but if it starts out with things I wouldn't say on this call, which sometimes happens to us, then it's probably going to just get dismissed into an email bin of garbage. But most of the time, I'm reading every other email that comes through, and my staff is too. And together, we don't miss an email. If you write to us, we're going to read it. And that's not the only way to get in touch with us, but it's definitely one. And the other is to make an appointment, which I will say yes to most of the time, and taking phone calls. My legislative assistant does field those phone calls, but I get a report of every single phone call that comes in. And if there's anything that I have more questions about, or if there's anything that she, who's brilliant, by the way, thinks needs further information or further research, then I get that same day. So we're hearing you.
Thank you. We have time for one more question.
Ooh, how about this one? Can we do this one? What advice can you give to folks who might be daunted at the idea of advocacy, thinking that it won't actually affect change? I love this question because if I'm being totally honest with you and pretty vulnerable, days before I won my election, I felt defeated. And not in the election sense, but in life feels so hard and I care so much about my community. Is it even possible, whether I get elected or not? Are we going to really be able to do an impact on the level of stressful things that people, we're dealing with oppression, we're dealing with racism, we're dealing with economic disadvantage, we're dealing with equity issues and lack thereof, we're dealing with, and I can go through all the things that you already know. And I thought to myself, is it even possible to make a difference? And I am here to tell you, yes, it is absolutely possible. It means making sure that you have people in these rooms that have your shared values and that you are telling us what you need, because it's amazing to me. I can't even express to you how cool it is to think that things that I dreamed of for 20 plus years as a social worker are coming to life right now. Wait until you see this budget that's coming out in 4 minutes. Wait until you see some of the things that we were able to pass off the House floor, including, and not only, one of the things is, getting behavioral health workers in schools, the second highest investment that we've seen, well, the next highest investment we've seen since the McCleary Act. We're finally doing it. We knew this whole time that it was important to have behavioral health folks in all these different spaces, and we're doing it. And so yes, keep working at it, because we can make it happen if we just line it up and do the work and meet the needs of our communities. That's what we're here to do, and we do that together.
Yeah, thank you. Yes, it's always nice to see social workers in your role, and I hope that we see more social workers in your role as we progress through the years, because we're doing it. We're doing it, and that's how we promote that social change. Is we get out there and we do it and we become vulnerable. Yeah, it's just amazing to see you as a social worker and other social workers at the Capitol doing that hard work and staying true to, our code of ethics and our practice.
Yes, well, thank you so much. I'm reading through the chat a little bit, and I'm sorry I'm not able to get to all of these things. There's such good questions, but I do want to tell you that my hope and inspiration, so the surprising thing, you asked me what have I learned in the last year. The surprising thing to me is that the amount of work that this job takes, if you're really passionate and heartfelt about it like I am, is pretty much 24 hours. It's a life. I mean, it is a full life. And knowing that, it's tiring sometimes, but I promise you, one of the things that keeps me going to do this work is exactly this, that I know on the ground, I have all of you out there doing the work to put these ideas in place, that if we get the budget funded, that you're going to go out there and you're going to change lives. So that's just going to keep me going. When we have all-nighters and I feel like my eyes are going to actually fall out because I'm so tired and I'm sad and I miss my kids, you know what keeps me going and keeps my eyes open? It's that I know that if I pass these policies here, that you are going to be out there changing people's lives. So please keep doing what you're doing. I am so in your corner. I am advocating for you every single day. I know you need pay raises, better working conditions. We're going to open up as many opportunities as we can to continue recruiting and retaining social workers, but you are on the ground doing the work, and I am so honored to be able to be here on your behalf because I know you're impacting people's lives.
Thank you so much. And thank you for joining us in person. I know, I feel like I'm best friends with your assistant.
I'm so sorry the tech issues were hard, but I'm so glad to be here in person.
I am too. I'm more happy that you were able to join us in person.
Sort of
Any
in person.
questions? Well, yeah, virtual person. Any questions that we have in our chat, I'll be sure to send your way.
Thank you. Thank you all so much. Bye.
So the last part of our day, and yes, we are a little bit behind, but I think this is a very important closing for us, is I would like to talk about one of our Legislative Action Committee members, Miss Nancy Amade. For those who know Nancy and those who do not know Nancy, Nancy has spent her life, in my eyes, advocating for the needs of people and for social workers. Her work expands not only the local and state level, but the federal level. One of her many achievements, and this is just one that I'll say, is around school lunches, around ketchup, considering ketchup a vegetable in the world of school lunches. But instead of reading her whole bio, I'm going to turn it over to Nancy for some last encouraging words, as, like I said, she has spent her lifetime advocating for the clients that we serve and advocating for social workers. Nancy?
Thank you. And just to be clear, when I was director of FRAC, the Reagan administration tried to count ketchup as a vegetable in the school lunch program so they wouldn't have to pay for the vegetables. And we summoned our nationwide community advocates and changed that. So we saved a lot of your brain cells. But I just want to say today has been absolutely terrific. This is marvelous. The speakers, the legislators, the legislative aides, it's absolutely, I especially appreciate today. And of course, I do want to thank the chapter for giving me a Lifetime Achievement Award. It means so much to me, in part because I understand that some of my former students were involved in it. And that also means a tremendous amount to me. So I guess the only other group I want to thank is everybody who signed up for this, including, I was surprised to hear that we've got people from schools all over the country. It's marvelous. So thank you for being here. And I just want to make an obvious point. Of course, there are social workers in direct service, not just in our state, but all over the country. But one of the things that we have to keep in mind is that is not the whole story. And you heard that repetitively this morning. Our chapter is special in part because we have so many social workers who make policy advocacy an important part of their lives. And just witness today's turnout. Even when we can't meet in person with our legislators, we stay involved. We call up, we write up, we speak up, we show up, we do advocacy work. That isn't true everywhere, but it makes such an important difference. And it makes a difference in the lives of so many people that we care about, as well as, you heard today, the legislators and the legislative aides. They said they want to hear from us, that it affects what they do and what they work on. So I decided that I want to sign off by giving you an assignment. And that won't surprise anybody that knows me. Within the next 24 hours, please use what you heard today to help at least one other social worker take action. Ask them to call or email their state legislators about at least one of the priority items that you heard about today. And if your colleagues don't know who represents them or how to do this, give them the legislature's toll-free line. It is 1-800-562-8255. 6,000. I will repeat that. 1-800-562-6000. The operators there are super helpful. They are wonderful. They can help callers find out who their legislators are, and they will happily pass along the legislator to their legislators any kind of message that the callers want to send. They can send a message about your key issues, the things that you heard about today. So that way, in just a few minutes, everybody listening today can help double our impact. And I think that's a good note on which I should end. Thank you.
Thank you, Nancy. Thank you for everything that you've done. In closing, I would like to thank everyone that has joined us today for the last 2 hours of this very jam-packed day of learning about what's happening at the Capitol, learning what NASAW is doing for you all at the Capitol, learning how to get involved, learning about bills, all that fun stuff. I encourage you, if you're not already a member, explore that option of becoming a member of NASAW Washington. The link is in our chat. And I would like to give a very special thank you to the Legislative Action Committee, who helped plan this whole event virtually over the last few months. The people who wrote our briefs: Christina Mason, Arden Hemmel, Claudia Selmar, Adrian Bertrand, myself, Jeremy Arp, Bob Cooper. I hope I did not miss anyone who helped with the briefs. The speakers that we had today, our president, Garrett Hebel, and everyone else that helped contribute today to making this day as smoothly as we can, given all of the technical difficulties that we had today. It's been a journey, and it's been a good journey. So as Nancy said, call that hotline number, get involved in social action, contact your legislator. Even if our bills don't align with you, get involved. And so I will leave you with that. Thank you, everyone, for joining us.